Okay, well, good morning, everyone. Thanks for joining us on this blustery Friday morning for another session of Design and Discourse. Today, we'll have presentations from Kiara Bartlett and Brooke Slater, who are both focusing on the impact of the built environment on psychological experiences of women, children, and family. So Kiara's presentation will begin. It's titled Patient-Centered. She'll showcase her research relating to the design of medical office spaces, specifically OBGYN, and the impacts of patient experience. Following Kiara's presentation, we will hear from Brooke, whose work is titled Spatial Design as Intervention, the Role of Interior Design in Supporting Children with Trauma. Both are extremely important and interesting topics, so I hope that you enjoy, and we invite questions and discussions following both presentations. I will now turn over the screen to Kiara. Thanks, everyone.
Hi, everybody. I'm just going to share my screen here. All right. Hello, everyone, and thank you so much for joining us for our presentations this morning. For those who don't know me, my name is Kiara Bartlett, and my capstone project is called Patient-Centered and OBGYN Office. Today, I'll be going over my project introduction of my entire project, a few case studies, my survey results that I have conducted the fall semester, and programming that I have done. So first, I want to start my project introduction. My subject is a safe office that supports the patients throughout their visit. My thesis statement is the disconnection between employees' efficiency and patient well-being while using the medical office and considering the patient appointment spaces. Considered spatial design that prioritize patient experiences over provider efficiency will result in an enhanced design that optimizes the experience and efficiency. My project objectives that I want to touch on during this project is to create a sense of ease for the patients while they go through each step, identify the role of wayfinding throughout this office, and explore the spatial arrangements that are affected by the medical appointments from the patient experience point of view. So why I selected OBGYN, it's because of my mom. My mom is a certified gynecologist and obesity medicine certified. She has owned a doctor's office and where we grew up, and I had the opportunity to work at my mom's office as a receptionist, among other things, and I found a passion and love for the connection between a patient and employee staff member in the healthcare center, while also noticing that the spatial arrangement throughout an office is affected by both users throughout their day-to-day life if they're visiting for an appointment or an employee that works there every day. As we all know, COVID-19 has had multiple impacts, including the healthcare areas, and I wanted to take this opportunity to create a space that is safe for everybody, but not noticeable to the COVID-19 perspective that we're trying to keep a 6 feet distance, just making it seamless throughout their visit at the office or their day-to-day life. And that's pretty much why I wanted to do an OB office and use my mom as my mentor. When I was conducting my research, I focused on 2 things, which was wayfinding and color theory. Wayfinding is a design strategy that assists others in unfamiliar spaces. The graphics and design implements can simple yet powerful to the users, such as arrows on the floor that's shown on this 3D rendering or model, and the grab bars that are also showing direction towards the hallways that they are needing to, or just simple posters that are showing throughout the space to give direction on where you're going next or where you need to be, as well as clearly identifying what floor, especially when you're in a large hospital, it can be definitely confusing moving throughout the spaces. The next area I was looking at is color theory. It is very important that I look at the color theory items because the red color that, as we all know, signifies emergency within the healthcare center. So I need to be cautious when I look at these colors. And red also increases heart rate and anxiety. So when I look at this color, I steer away from it moving forward, just because I want to create that sense of ease for the patients. The yellow signifies inspires creativity. However, it also indicates caution that we have seen while we walk around our built environments, seeing the caution cones and different signs in our built environments that I need to be careful about when I use this specific color. However, the blue, green, and purple all signify the calming and security and of emotion within the built environment. So in implementing these three colors in my space, I'm hoping to achieve a sense of ease for these patients just by using a specific color rather than changing the design altogether by making that small change throughout this office. Moving into my case studies, I have looked at multiple different case studies throughout my research. I have looked at 4, and one of them is the Parsley Health OB/GYN office. Right off the bat, when I looked at this office, I noticed that it is not traditional. It is not your standard office that I personally have been to. This office is located in LA, and they took a definitely different turn when they designed this office. Within the waiting room, there is a large corner of natural light that brings into the space, and there is a juice bar as well, or a beverage bar that they use throughout their day-to-day, that they can make smoothies or juices or waters or whatever in that space for the patients, while also helping the employees that they are allowed to use. The front desk is divided by a small dividing wall to the waiting room that also brings in lots of natural light right into the nurses area and exam room hallway. The other area I looked at was the patient rooms. And when I first looked at this, I was questioning what that table was for, since I've never seen one before in a exam room. However, I thought about it, and it definitely alleviates or eliminates the hierarchy standard of a patient to employee. So when I look at this, I think this would be a comfortable setting for me to sit at, not on the table, just having a casual conversation with my physician or nurse to get the information that I need without having that barrier of having a hierarchy looking at my physician. The hallway has architectural elements and mimics the natural light that is being brought up from the front waiting room. It is simple yet impactful that shows each room when they have the dividing walls for the architectural elements to know where the next room is at within that hallway. I also looked at the space, and I wanted to identify each step by the user, the patient, nurse, doctor, and doctors while they're moving throughout their day-to-day life. I also did hot points that have high traffic that are signified by the green circles. And that, for me, when I look at that, I notice that there are a dead end, or it is adjacent to the front receptionist and exam room, since every single patient would most likely be going into one of the following exam rooms, meaning they have to go through that hall. However, that hallway is a dead end, which can cause traffic from both pathways, and this hallway does not seem to be large enough with that architectural elements. However, it is impactful and beautiful. It may cause a problem throughout a high traffic point of the day. When I was looking at this, I also wanted to identify exactly what rooms that they were going to be going into. So I took that next step, and I highlighted each room that they would be taking, rather depending on what appointment they went to, if it is just an OB appointment or an annual appointment with a physician or nurse, and identified by who would be with these patients while moving throughout, if they would be with the staff, additional treatment, or a private space waiting area by signifying each color. When it is an OB appointment, they possibly will have extra testing or blood work, meaning they need to go to a separate room. I've identified that the testing room is adjacent to the exam rooms, as well as the bathroom for the patients, and which means that is an extra step. So it is very crucial for them not to be walking completely across the office while visiting. An annual appointment may not need to do this. However, they do need to take the common 3 steps, which is going into the check-in, waiting room, possibly using the restroom, and being with the staff by taking their vitals, seeing their physician, and then checking out. So all of these steps are going to be common for every single patient. However, there could be possibly extra steps for the people that may need additional treatment. So when I looked at this space, I realized that they are possibly going into a dead end zone and there is a private office back there. And when I went through all these case studies, I noticed that the private offices being adjacent to the exam rooms could possibly ensure a unprofessional or not as a casual conversation setting in the hallway rather than being in the exam room for the patients, which can cause anxiety or ease throughout their visit. The next case study that I looked at was the Bronson Health Center, which is located in Marshall, Michigan. This office is significantly larger than the past case study that I was looking at. This one is a definite traditional office that I have personally been to. So I have felt when I was looking at this would be an office that I would be going to rather than the LA office that I previously mentioned. This office used to be partially a orthopedic office as well as a pediatrician OB office, and now it is an orthopedic / OBGYN office. So they do have a x-ray room and screenings for the orthopedics that I want to mention throughout. And this office has a large nurses station that is behind the receptionist desk and also adjacent to all the exam rooms. This nurses station is wide open, meaning there is no privacy or poor acoustics. It's a high traffic area since it is adjacent to the receptionist area and also the vital stations. Some of us may know of HIPAA, which can also cause an issue throughout this space. HIPAA would be talking about patients while other patients are present about their personal information, meaning when the nurses are sitting at this area, they need to be cautious about what they are saying and or move to a separate area to have a private conversation with a physician or another staff member regarding a patient. When I look at the vital stations, I've noticed immediately when I was going through this space, since I did go and visit this office, it is directly next to the waiting area, and there is no privacy for the employee and or the patient while taking their vitals, such as weighing in, blood pressure, etc. As well as there's no acoustics being helping this area to make sure that there are no HIPAA violations being occurred during this space. Like I mentioned, the nurses station is adjacent to that checkout and reception area. And then the patient rooms, there are 3 different hallways to get to the patient rooms throughout this office. The patient rooms are great in theory. However, just one little minor detail, the computer is broken. That is not useful for the employees when I was talking to them, that it can be very frustrating. However, since we are moving into more of a laptop or an iPad area in our generation, that they are not needing this computer, along with not having enough cabinet storage and counter space for all the equipment they need throughout their visit or their appointments throughout their day. So when I was talking to these employees, I've noticed that they just needed a little extra more room for cabinet space and a solid surface to put the clean, sterile equipment on, and making sure that it is sufficient for both the patient and employees. I also did the same thing as I did on my past case studies by looking at the flow of the traffic and noticing the high points. And as I mentioned, the high point is definitely by that checkout, vital, and nurses station, since every single patient would be going into that vital station before going into their next step in their visit, along with the additional testing area, since it is in a separate hall around the nurses station, going back through the checkout or receptionist area to get that additional testing can create a high traffic area while moving throughout their space. I also moved forward and took that extra step by going through each area, identifying where they would be needing to go throughout their visit. And like I mentioned, the exam rooms are separate from the extra testing rooms, which can be great in theory. However, walking through that front can cause a sense of anxiety and seeing the extra users throughout the space, people they may not want to see, or just having a large group of people in that waiting room waiting for their appointment, and then seeing the people walking by throughout the back of the office can create a sense of unease or anxiety throughout their visit. Throughout this visit, you can see that they have additional testings that they may need to have. However, I would like to point out that there is no ultrasound within this office. Their ultrasound tech is in the hospital point of their office, not in this private building that is not near the healthcare or hospital. And so they may need to take an extra step to go to the hospital throughout their visit. On the same day or on a different day altogether. However, they do make the same exact steps comparing to the OB office appointments first the annual by checking in, sitting in the waiting room, checking vitals, and going into that patient room or exam room and talking to the healthcare workers. Comparing the two, I wanted to go through all 4 of my case studies and compare every single case study that I looked at and identify the relationship between the spatial arrangement and circulation of patients. When I was looking through, as I mentioned throughout the past too, is that the high traffic areas are between the nurses station and the receptionist area, since the people will have to go to the receptionist, and the nurses will always be at that nurses station as they're working throughout their day to day, meaning there's going to be lots of people and definitely many noises and echoing going on. So we need to make sure that the acoustics are being treated thoroughly. Another area that I noticed is the vital stations. Throughout looking at my case studies, 3 out of 4 of my case studies had a vital station outside of the exam room, located just in the hallway adjacent to the exam rooms or the waiting room. Meaning, like I said, they're small. It may not have any wayfinding. The ones that I have currently looked at of all the offices, there are no wayfinding signs, meaning that these vital stations are just in the hallway, but also can be confusing because some of them are identical throughout each hallway. Another area that I identified that reasons for high traffic is having a dead end of a hallway or being adjacent to the patient and private offices, since people would be going in and out throughout their day constantly. And when I looked at these issues between the spatial relationships, I wanted to understand how I can improve these areas moving forward in my project, which is by incorporating the wayfinding symbols and showing signs throughout the rooms by identifying each room, exam room, testing room, nurses station clearly by knowing that this is an area they can or shouldn't go in. If they are by chance walking out of the office alone, they are easily able to walk themselves to the receptionist without any confusion, as well as incorporating effective lighting. When I talked to a few employers and patients, that they have mentioned to me that windows can be effective, yet also hard to work with if there is a glare, or also making sure that privacy is ensured for the patients and employee safety. So making sure that there is effective task lighting when needed during their surgical hours, or just a day-to-day job sitting at the desk, making sure there's efficient lighting and or natural lighting that helps them throughout their day. And then also creating a sense of ease by having that extra large hallways, by having a 2-path hallway when they are moving throughout the space will be effective for both the users, patient, and employees, so they can get around with either equipment, extra things in their hands, and or a guest wheelchair, stroller, etc. And there will not be that awkward stopping point. We have to walk around each other and keep on moving when you go throughout the office. So these are the 3 things that I noticed when I went through my case studies, and I know there are more to identify that I will be continuing to look at when I go throughout my design process throughout this semester. Like I said, I created a survey throughout the first semester of fall. And when I was doing the survey, I noticed 2 things. One, there is a clear difference on what offices people have been through in the past and how that affected their survey results when taking mine. And this is between generations, which makes complete sense, because as we looked at the LA office, that is a newer office that my generation may be more comfortable with, rather than the 41 to 79-year-olds may be used to a different style, which is shown in these images. The 41 to 79-year-olds decided that the waiting room office on the far left, is something that they would be appealing to them, which is a standard office with standard chairs and a few windows for natural lighting, rather than 18 to 41-year-olds personally preferred this waiting room with more different types of seating arrangements, lighting, and also colors throughout the space. The exam rooms on the right side are the two rooms that the 41 to 79-year-olds and the 18 to 40-year-olds preferred. The 41 to 79-year-olds preferred a standard exam room, which has everything you possibly need for throughout their visit. It has all the standard materials and equipment that is needed. Whereas the other image shows, like the case study that I looked at, has that table. That different type of seating arrangement is new for people. And this is definitely pointing out that there is a difference between generations. So when I move forward, I need to understand that multiple different users are going to be using my space. So how do we combine the two of these preferred spaces into one for all user groups while moving throughout their spaces? So I took this survey and I'm moving forward by incorporating that within my design and going to be sending additional survey to ask more questions regarding the new spaces that I've created. Moving forward, I identified the programming procedures throughout my capstone project. I want to identify the level of comfort required, such as that waiting room and exam room survey that I conducted earlier. I need to identify what is going to affect the level of comfort, such as conducting that survey, including wayfinding, lighting, and furniture for all users. I also want to identify the client attitudes towards the social and psychological environments. And I did this by creating my survey, and I've got lots of feedback back on how they feel. And it is completely different by all generations. They may feel excited since it's exciting, a good appointment, or they may feel sad or uneasy, stressed, worried, etc. No one can tell you exactly how someone's going to feel. So just keeping in mind when I move forward that there is going to be a world of emotions throughout a patient visit is important for me to remember. Next is evaluating the space and how much space is needed for the number of people that would be in there, such as the exam rooms, if there's going to be additional guests, or the waiting room, knowing how many patients are going to be moving throughout the office in the day-to-day. And then identifying the effective progression of flow of people and things. And like I mentioned earlier, that is including the wayfinding, but also identifying the day-to-day life for each user, knowing how many people are going to be at each space and who's going to be moving throughout where. And also knowing the time frame. How long are the appointments going to be? How long are people going to be waiting rooms? How many staff are going to be in the office, etc. And by doing that, I went into the next phase by creating the patient day-to-day life. This graphic shows the 3 different users throughout the space. The inner circle shows the patient, the next circle shows the nurse, and the outer circle shows the provider. The inner circle just shows how a patient would move throughout their day as identified in the case studies, checking in, using the restroom, etc. Whereas the nurses are going to be taking lots of patients back, taking their vitals, throughout their appointments, as well as talking to other staff members, such as their provider, and or taking notes for their paperwork and documenting throughout their day. And then the physicians may have in-house surgeries throughout their day that they need to keep in mind throughout their office day, as well as talking to other staff members, seeing the patients actually, and also documenting their paperwork for their charting for each patient throughout their visit. So this graphic really showed me how quite difficult it is to understand the flow of the people throughout the spaces, since they do have multiple different steps, and there are many different other things that may need to do that is not shown here. When I was talking to my mom while doing this, she said that there are many different tasks that she may do that are just 10 minutes that may take away from her day, and it's important to keep in mind that these little tasks or phone calls to a patient do take up time, so it's important to understand the flow of how people are going to be moving throughout. Now I have selected my location. I selected a previous case study that I was looking at is the Bronson Health located in Marshall, Michigan. This is my hometown and it is just about 40 minutes shy from Kalamazoo. And when I went here, I realized that this office has lots of potential for the office that I want to create that is patient-centered, focusing on the patients, while also implementing the needs for the employees. This office is located in a very small town. It is all about community and it is perfect for this office that I'm trying to create in this space. That is my presentation. Thank you all so much for listening, and I will take any questions after Brooks.
Can you see the screen correctly? Perfect. Okay, for those of you who don't know me, my name is Brooke. For my capstone project, I have focused in on trauma's effect on children's development, specifically spatial design as intervention, the role of interior design in supporting children with trauma. For today's agenda, we will be going over my project introduction, research, which it can be seen as defining trauma, the developmental milestones within children, specific trauma-informed design principles, design considerations that I've gathered based off of previous research, color psychology, and some precedent studies. So what is trauma? Trauma can be defined as an emotional and/or physical response to an intense singular or reoccurring event that has lasting effects on an individual's functioning mental, physical, and emotional health. Trauma overwhelms an individual's ability to cope, diminishes their sense of self, and the ability to feel a full range of emotions and experiences. So when looking into trauma, I noticed that there are so many different types of trauma that a child may be facing. I've decided to focus in on 3 different types. These types are abuse, which can be seen as physical, emotional, or sexual, and is when an accidental or a non-accidental injury, activity, or behavior happens between a caregiver and, in this instance, a child. Poverty puts children at risk when they are living in unsafe living conditions that may affect the way that they sleep, play, as well as the food that they eat. And lastly, caregiver substance abuse or mental illness, which when a caregiver is going through substance abuse or a different mental illness, they are not able to provide and be present with the child in order to guide them through different milestones going on within their life and to give them the emotional support that they may need. Sorry, it's not letting me move the screen with all of our faces on it to see the rest. Okay, so after doing more research on these 3 different forms of trauma, I didn't want to specifically assume that a child may only be facing one form of trauma. So I started looking at their different intersectional qualities. So abuse, poverty, and parent substance abuse and/or mental illness overlap in ways that a young child may be affected or at risk of another form of trauma. While a child is facing emotional abuse, it may be a tripling effect from their caregiver that is also going through mental illness or is stressed out from the experiences that poverty presents to somebody. So the intersectional qualities and relationships contradict the contrasting ways that a child may be affected by this. And it's important to recognize that a child may be coming from trauma that is coming in multiple different forms rather than specifically just one form. When working with children, it is important to keep in mind developmental milestones. So developmental milestones are different goals that a child should be reaching near or around specific age in their at a young age. They have the developmental milestones that are important that they will be reaching in order to grow properly. So I created a storyline, and this one is focusing in on the traditional developmental milestones that a child will be reaching. So Lila is 5 years old and recently started preschool at Okemos Public Schools. While at home, she has a very supportive and loving family that has followed in line with the developmental milestones she should be reaching so far. One of the milestones she is currently working towards is knowing her home address so that if anything ever happens to her, she may be able to vocally say it out loud to another adult. So traditionally, as a 1-year-old, Lila was able to pay attention to speech. She was imitating words that adults are saying around her. She typically may cry when a caregiver leaves her side, and she shows preferences in people. At 2 years old, Lila began to show her behaviors, follow simple directions, was able to notice when people were upset or were hurt, and tended to look at faces for reactions when a situation was happening. At 3 years old, she was able to calm down after parents leave. She notices when other kids are playing around her, and she is able to have conversations. At 4 years old, she was able to comfort those who were sad or hurt. She enjoyed helping out, and she was able to find solutions to different problems. And at 5 years old, she wanted to be like her friends. She was likely to agree with rules, and she knows about items used at home. So on the other side of the traditional developmental milestones, I wanted to be able to look at the reactions and the ways that trauma plays a role and it affects these children's milestones. So for the next slide on the opposite, I have redone the developmental milestones and the ways that they have shifted based on a child who is facing trauma. So Lila is 5 years old and recently graduated from Okemos Public Schools Preschool Academy. At home, she does not receive positive care from her caregivers and oftentimes comes to school with bruises covering her body. With concern, her teacher has noticed that she is lacking milestone growth and seems to have irrational emotions. So in the way that the trauma affects a child, as a 1-year-old, Lila was scared of noises, seemed to be in distress, or was being out of routine. People had difficulty soothing her, and she had difficulty forming attachments to caregivers around her. At 2 years old, she was especially fussy. She had high levels of distress when she was separated from those caregivers who she had relationships with. She had a loss of playful and engaging behaviors, and she oftentimes was showing regressions after reaching certain milestones. At 3 years old, she was showing aggressive behavior, avoiding eye contact, and may have loss of eating skills. And at 4 years old, she had difficulty with problem solving, language delays, and had difficulty forming relationships with peers. At 5 years old, she had social withdrawals with those surrounding her. She may have trouble with concentrating and had a poor understanding of social interactions. So between looking at what the traditional developmental milestones were or what was ideal per age in or around, and not necessarily at that exact age, and the ways that trauma has affected them, there's a great difference in a timeline of ways that a child may be effective or may fall off track of what the traditional route is. For my research, I found trauma-informed design principles. These principles are integrating principles of trauma-informed care into design with the goal of creating physical spaces that promote safety, well-being, and healing. So physical environments can affect identity, worth, and dignity, and how it promotes empowerment. The principles seen can be collaboration and mutuality, trustworthiness, voice and change, transparency, peer support and empowerment, and safety. So some general guidelines for trauma-informed design principles are between spatial layouts, creating clear sightlines and fewer barriers to create a sense of safety and calmness, visual interest with details, avoiding deeply hued colors as they may create or arise negative emotions within these children. And furniture should be durable and easy to clean with arrangements that can enhance safety and promote positive relationships between employees and children. So a lot of these children may be coming from spaces that they don't necessarily feel safe or have trouble creating relationships and connecting with others mentally. And so creating different furniture arrangements and just guidelines that make sure that these children who are facing and experiencing trauma are also interacting and creating relationships with the employees who they will be with. So some goals of these trauma-informed design principles are creating environments that promote the ability to feel calm, safe, and empowered for all users. And another goal is creating a calm and nurturing space that can come from adaptive spatial layouts, intentional furniture pieces and arrangements, light, color, and biophilic touches. Play therapy is also another huge part of my research that I looked into, and it was very interesting. I learned a lot of knowledge about play therapy as I did not know anything about it beforehand. So play therapy is a form of therapy where children use play, toys, and games to help explore, express, and safely experience the difficulties that they are experiencing. Children who have been abused or experienced traumatic events may benefit from play therapy to regain a sense of normalcy in their lives. So there are two different forms of play therapy, directive and non-directive. Directive is a hands-on approach leading a child through guided play activities that help them express themselves. And typically a child will receive the instructions during directive, and then they will be supervised by a therapist as they experience activity to see the reactions and the way that they feel about these activities. A non-directive play therapy is when a child is left alone to engage in whatever play activities they may enjoy within the space, and they can express these emotions with limited interferences. So the difference between the two is one is hands-on, and there will be somebody guiding them through the experiences and the activities, while another is a child exploring on their own. The goals of play therapy are to build communicative and learning processes of children. It helps aid children in expressing their emotions in a way that may not be verbally said, as some of these children, especially at a young age, 1 through 5, they might not be able to understand the ways to communicate, or physically may not be able to communicate. And those who are facing and experiencing trauma may just have difficulties. So an employee in a space can better understand them based on their expressions and their emotions of play therapy, and it may understand what they're going through better because they can't physically talk about it. Another goal is that it allows children to react, think about, and resolve their challenges. They are able to develop respect and acceptance of others, and it educates children on more responsible behaviors and developing successful strategies for them. A couple benefits of play therapy is that it creates a space where a child feels comfortable being themselves. It allows children to take charge and engage in activities that will activate developmental milestones in therapy processes. It allows children to understand their emotions better and helps navigate communication and social skills among adults and other children. Some techniques and forms of play therapy are the puppet play, building blocks, sand play, and different board games or Legos. So design considerations. When looking and doing more research I wanted to look into specifically different ways that children would benefit and react from different things such as lighting, biophilia, thermals, and security. So for lighting, it is important in my future space to incorporate the usage of natural lighting and brighter rooms in order to promote better mental health and behaviors within the children. Biophilia is beneficial for children as it can reduce stress level, inform connections to the outdoor environment, and increase the healing process. Thermals, it has been proven that colder temperatures may decrease the negative effects that a child may have from trauma, while too warm of temperatures within a space can increase the effects of the trauma or may make children feel different emotions that we're trying to heal from. And security. Security is very important because both physically and mentally, a child needs to feel that within the space that they can trust those who are surrounding them and trust the environment. So while the children occupying the space have effects of trauma, they may face attachment challenges and or have trouble connecting with other students and employees. So being mentally safe, they'll be more open to speaking, playing, and connecting with others surrounding them. And physically, it is extremely important to make sure that the children are in private spaces where the public cannot access them in order to protect the kids and also for those who shouldn't have access to them. So color psychology. I wanted to look into the different ways that color specifically guide children in the ways that the colors affect these children and their emotions. So some general notes that I got from this research are that colors are most used by children to express their emotions and thoughts. And another thing that I came across was in educational spaces that the spaces need to increase creativity and imagination. So looking into the different colors and what colors create that sense of creativity and imagination. These colors can specifically within children experiencing trauma can arise both positive or negative effects on children. So making sure that within this space, there aren't colors that are going to trigger or offset the process of healing. And excessive stimuli can cause damages to breathing patterns, muscle tensions, and blood pressure. So the breathing patterns, muscle tensions, and blood pressure can all come in forms of effects that a child may be affected by trauma. So understanding the ways to get around that and continue on the healing process. Getting into my president studies. So I looked at a few different surrounding businesses in the mid-Michigan area, and I took my president studies from a different perspective as I wanted to look into spaces that were doing what I wanted to succeed in my future space. And I looked at what they were doing positive and the ways that they were incorporating that. So the first place I looked at was the YWCA. Their mission statement is focusing on improving the lives and well-being of children through providing innovative, high-quality childcare and educational programs that support vulnerable children. For each of my president studies, I created a blocking plan preliminary based off of what I saw in interior images and exterior images. And so in the top right-hand corner, I've created a plan of what the space may look like and also separated it by public, semi-private, and private. So looking at the interactions that the different users will have within the space, especially to keep in mind the security and the privacy of those children. So then I took that plan and I also gathered images of the interior to reflect back on. So at this front entryway, at this image, it is a first spot that children and the users will walk into every day. And it is a small room, but there are many different security points so that the people who should not have access to the children and the other semi-private areas with the employees and the children, they will not get past this point. The common area there's a mezzanine overlooking the common area, and it is a common play space that all of the children will be using together. And so the interactions and the social aspect of these kids healing from trauma is what I was looking at within these pictures. And then some key takeaways that I gathered and just more general knowledge that I wanted to note on was that the YWCA assists parents with tuition so that all children have access to their education. They have programs available that encourage the health of children through professional development and mentoring. They provide safety and security throughout their space. So they have a huge emphasis on how at times that this may be the most trusted space in a child's day. So a child coming from trauma at home or the chaos at home, when they walk into this space, they want to understand that this child, it may be their safest spot that they have, and encourage them to feel calm and to feel at home. So the next one kind of falls in line with it, that they have classrooms that are designed to feel like a hug. So again, when a child is vulnerable and comes from chaos at home, they provide them with a sense of calmness. My second case study was on Learn and Grow in Otsego, Michigan. Their mission statement is our nature-based preschool provide outdoor exploration experiences for 3 and 4-year-olds. We will enhance students' understanding and connection to the natural world while building skills and the needs of the whole child. So again, I created another plan, and these plans were extremely helpful when I began moving into the programming phase of mine, looking at the different spaces that they have available to these children, as well as just the interactions of space and circulation of space. For their interior images on the left side, I'm specifically intrigued by the different play space photos. So they, as well as the YWCA, have a general space that these children gather together and interact socially with each other. And so a lot of it is these children are experiencing different aspects in a form of like the directive play therapy, non-directive play therapy, where they are able to go off and explore different things on their own. And then their outdoor play therapy falls in line with their mission, that they provide outdoor exploration experiences. So they have activities outside rather than a typical playground or a sand pit that help the growth and of the developmental milestones and make children think mentally through the activities that they are provided with. Some key takeaways that I found from Learn and Grow was that they focus on providing children with exploration experiences, both indoor and outdoor. Each program is identified to be catered towards specific age and developmental milestones, so falling in line with one of my key focuses on what I want my future space to be. And they have small class sizes, making it low student caretaker ratio. There's between 10 and 16 children, which a low student to caretaker ratio allows children to feel connected and mentally grow with their caretaker. The last case study I looked into was Milestones Early Learning Center, which is in Portage, Michigan. Their mission statement is to apply an evidence-based, hands-on approach in child development. Children learn through interacting with their surroundings and daily experiences while in a safe, secure, warm, and nurturing environment. For this one, the interior, I did not include my blocking plan going through the circulation of different users because I had the opportunity to interview with their assistant director and ask them specific questions that I was wondering in order to improve my knowledge for my future space. So for my interview, I wanted to review some of the questions I had asked her and what she had responded. So what resources are there for children who have experienced trauma in the past or present that are now in your classroom? So in their classrooms, they have designated safe spaces that are away from others while a child is sorting through their emotions. So within the safe space, there may be materials such as pillows, squish toys, and family photos. And she also talked to me about how when trauma is defined beforehand, there are private meetings that are set up in advance that make sure to support this child in the best ways possible while moving through their early learning center. I asked if there was anything challenged children typically need that they don't currently receive from their educational center. And like the last case study I looked at, she believes that children would benefit more from lower ratios or one-on-one care and attention from a child in need. In attention to a child in need. So again, when a child is facing trauma and they may be coming from any of the key different trauma types that I'm looking into, they might not have the support mentally or physically at home. So understanding that when they come into this space, they're looking for the support. And if there's a classroom with large people or there's not one-on-one time to make sure that developmental growth and milestones are being hit, then the space won't support the child to the best of their ability. So the last thing that I talked with her about was what kids could have benefited from before walking into the early learning center. And she's the one that introduced me to play therapy and how it's a powerful tool, and they highly recommend it to a lot of people. So I hadn't heard of it beforehand, and now doing my research, I understand why it's highly recommended to a lot of families, because it can be seen within a counseling center, within an early learning center, preschool, but also it's very useful at home. And in order to create this therapy and support a child, it has to be reiterated through all phases of their life. So for the blocking plan with interior images, some things that I had noticed were that they also have a common play space. And in this instance, their common play space opens directly up to the outdoors in their outdoor play area. So the outdoor play area, again, does not have any common or traditional playground settings or sandboxes. They have small track and just let the children explore, but also within this play space by using movable garage doors that allow kids to have the natural sunlight, connect with biophilia, and can go from inside to outside and explore different activities. Some key takeaways that I learned about Milestones Early Learning is that all of their curriculum is written with principles of child developmental milestones at the forefront. They're designed to provide children with developmentally appropriate learning experiences. Each classroom is specifically equipped to foster the needs of each child's age. So depending on what classroom, I have their classroom separated by 0 to 1 years, 1 to 2 years, 2 to 3 years, and so on. And so in my future space, making sure that each separate classroom where a different group of young children will be coming in best supports them and also allows them developmental milestone growth and supports that of them. And lastly, that their classrooms are designed in order to provide sensory stimulation, which is vital to the learning processes. I believe that is all I have. Thank you guys for taking the time for come to our presentations today.
Thank you so much, Kiara and Brooke. Those were phenomenal, and I really appreciate you taking the time to share those with us. I do have a question that uniquely applies to both of your projects. Well, first of all, it's really interesting to see this amount of research and realize that it does happen that patients and children are not always the primary, people we're thinking about when designing a space, so we can do a better job at considering them. From your research and your findings, and as you transition your project into your own kind of design, have you found that there is an ideal ratio of patient, physician, and then number of maybe offices or size of the entire office? And for Brooke, that would be maybe like the amount of children to the instructor or staff member to the size of the center. Have you found like a unique balance there?
When I was looking at mine, I realized that it is smart to have one provider per 2 exam rooms. And that means so they can alternate between visits and go to room while the nurses are rooming them. So it is the most effective way by having at least 2 exam rooms, so their patients are able to get into a room, and it's faster and efficient experience, specifically for mine.
For mine, I think that in my president studies, it just showed that it's depending on what the space is going for. Ideally, I believe that it's one per every 10 to 12, one employee per every 10 to 12 children, but that's not necessarily saying that there's going to be 12 kids in the 0 to 1 year old group. It would just mean that there's going to be multiple employees to make sure that they're fully taking care of all the children, because especially experiencing trauma, these children have, like I've mentioned 10 times today, different milestone needs and different growths that they need to experience during their fundamental years. And so supporting them best by having an employee look after a certain amount of people is the most, is the best.
Yeah. Have the work that you've done and helped like inform or inspire each other? So like, Kiara, are you now thinking about play therapy? Because children come into these offices too, and families. And then also with Brooke, thinking about some more of the caretaking aspects related to the children that maybe Kiara has identified too. Are you inspiring each other or finding a synergy?
I would say I mentioned it to her that I kind of want to learn a bit more about play therapy, since I do need to have, like, in my waiting room, area for the children, and other aspects within the office for the children and for my project. But we've definitely bounced ideas back and forth throughout this process.
Nice. Does anybody else on the call have questions or comments? Feel free to just unmute and ask, or even type it in the chat. We don't have too much time. We're just a few minutes, but enough time for one or two more.
Presentations are super insightful and interesting. Specifically with the patient center one, I know there's a lot of people are like completely scared of the doctor and just like don't like haven't in years, and like it's hard to like finally go, and especially then like for older people going into like a younger generation like fueled place, maybe that could help ease some of that like trouble for them and make them feel young again, which is really cool.
Thank you. Yeah, it's definitely been something I've been keeping in mind, just creating that like perfect mix for everybody and all the users. So that survey that I conducted was definitely useful to identify the differences between the generations.
Yeah. Okay, well, if we don't have any more questions or comments, I think we can close out today's session. Thank you so much, everybody, for joining or, watching after the live event. It's been really great watching these projects progress, and I look forward to seeing where they are at the end of the spring semester. So, all right. Thank you, everybody.